I pledge to stay drug free.
I plan to stay drug free.
I pledge to stay drug free.
I pledge to be drug free.
I pledge to stay drug free.
Good afternoon and welcome to Expose Under the Sun. I am Sharon Dumas. I am your host today. I'm filling in for Darwin Griffin, who will be here next week. I'm excited about my guest today because of all the things that are going on and how it is so important that we pay attention to the healthcare industry. So I just want to say welcome to Lakita Mitchell. How are you, Lakita?
I'm good. How are you today?
Good. You're an RN and owner of Mitchell Healthcare Training Center.
Correct.
Tell me a little bit about your background and how long you've been in healthcare.
I've been a nurse for almost 15 years. I got into it because I love people. I love taking care of people. I'm just a nurturer by heart, and you show compassion, and it's gratifying for me to be able to make a difference.
I'm sure. Now, I couldn't do it. I cannot stand to see blood at all. So thank you so much for your service in our community and working in the healthcare industry. Tell us about your business, your new Mitchell Healthcare Center, Training Center.
Well, I am a training center to train individuals that would like to become a certified nursing aide. It's an 80-hour program, 3 weeks. We can complete the program in 3 weeks. And that's like a stepping stone into your healthcare field. Hopefully encourage them to go on and become nurses.
Okay. So that's the acronym CNA. I see a lot of different places that says CNA. That's Certified Nursing Assistant.
Mm-hmm.
What do they do?
They actually do a great deal. They have more contact with, they have the most contact with residents. As far as being on with the healthcare team, they assist with bathing, dressing, feeding, toiletry. They're like a companion.
Oh, okay. Do they do any vitals at all?
They do vitals. It's very important for them to be trained properly because nurses depend on the nurse aides to relay any changes that a resident may have promptly, and it's very important for them to have that training and be properly trained.
I see. So being in the healthcare industry for so long, I'm sure you have some like pet peeves that you, in working with other CNAs, that maybe you made sure that you were training in that area with your center. What are those pet peeves now? I've had to be in the hospital a couple times, and I can tell the CNAs, some of them are really...
My biggest pet peeve is for CNA to make a resident feel like they're an inconvenience. You have to, this is not a field that you go into for money. You have to genuinely have it in your heart to want to take care of these individuals. Another pet peeve is attire.
Thank you.
I need you to be presentable. I'm not sure where it was deemed okay to not dress appropriately, but no, you are part of a professional healthcare team, and you are important on that team, and you need to be presentable.
You know, I appreciate that because I've had an encounter with CNAs, and they had long nails, multicolor. And that's their business, but you think when you're coming into a hospital that you really didn't expect that unless they had on gloves. And then also some of them had such attitudes as well, as if they didn't want to be there. And my thought was, if you didn't want to be in this industry, why are you here?
Absolutely.
So those are some of the things that you work on as well?
Yes, I stress throughout the entire program, you have to put yourself in the shoes of the resident.
Yes.
Think about that. You know, I've always, from day one, I've taken care of my patients like I wanted my parents taken care of.
Right.
So I stress that. Give top of the line care. You know, it may be us one day. It may be your mom or your dad, and think about how would you want them to be treated.
Absolutely. So that means that if they graduate from your school, they'll have all the tools that they need to really be a caring CNA.
Yes.
Got
Yes.
it. Would you give your contact information for us?
I am located in the city of St. Clair Shores. The address is 23217 that's NINE, Mac Drive, St. Clair Shores, 48080. Phone number is 586-451-8787, and my website is www.mitchellhealth1.com.
Okay. And if you could give your phone number one more time.
It's 586-541-8787.
So what are some of the things that you cover in CNA training?
We cover the abuse, preventing abuse. We cover proper feeding, proper positioning, proper transferring, because that's a huge issue. Is, you know, CNAs help to ambulate the residents, so we definitely do not want any falls. So I kind of extended that portion of my program to ensure that they had more than enough training that's required to make sure that our residents are safely transferred.
And I'm sure that the industry right now is looking for so many CNAs because of all the things that's going on with COVID-19.
Oh yes, there's a shortage of CNAs right now. I have 2 facilities that are waiting for my students to graduate so they can go right into a job.
Wow, that is great.
And they have great benefits and they have nice pay.
That's great. So I asked you to bring some of the PPE so that people will learn how to put them on and what we should be doing. Also, I did some research as well, and it looks like our numbers are up quite a bit in Wayne County. So far, there's been 42,963 people who were tested positive and 3,062 deaths. And we're at the top of the chart, of course.
Yes.
And right below us is Oakland County. But wow, that's amazing. And then as far as Michigan is concerned, 204,000 reported positive and 7,732 as of today that are deaths.
Yes, the rates are increasing, which is very concerning. You have to wear your mask. Hand hygiene is priority number one. Proper use of your mask, not below your nose. And I get it. Everyone is tired of it, but this is something that we have to do to, fight this pandemic. And unfortunately, we're on the rise again.
Yeah, that's unfortunate. And we're sitting here in the studio without our masks because they have a disinfectant that's spraying in the air. But walking into the building, we had to wear our mask. So that is just so important. So can you tell me what's the best kind of mask to wear?
Well, the N95 offers you the most protection. I see, they're saying to use the surgical mask, and those are the blue masks. And that's because they want to, the CDC wants to make sure that the healthcare providers have enough of the N95 mask.
You have one?
So what I have here is, and I purchased this at Menards. It's a little bit pricier than the surgical mask. So this one is, it has like a cone shape to it. And when you put your mask on, so this is the outside. This outside is considered to be the contaminated area. You want to keep the inside clean because that's the part of the mask that's against your face. But when you apply it, you want to take it, grab it by the straps, and apply it. Put it behind your ears, and make sure it's secure under your chin. And you mold this metal piece to ensure that you have a seal here around your nose. When you remove it, you want to grab it by the straps.
Aha. So even myself, I grab the mask itself, not by the straps. So that's really important.
Yeah, this part is considered contaminated. And like on the blue mask, you really want to fold it when you store it. You want the this is the dirty side. You want that to face folded where it's facing each other. Each side is facing each other, and then you put it inside a Ziploc baggie or paper bag. So because that's considered clean, and you want the clean part to face the clean part of the bag.
Oh, okay. So those, what, N95?
N95s.
In construction, when I was in construction, they used that when they were cleaning and paint and stuff like that. So that's what that one is. And you got it from Menards.
Yes.
Because the ones that I see most are the blue ones. The they're not surgical, right? They don't look surgical.
Well, we call them a surgical mask, but they don't provide as much protection. And if you have to use those, I would just suggest, take a bandana, put it over that to give you some layers.
Oh, so that's not necessarily the safest. Is
No,
that
it's
what you're
not.
saying?
No, it's not.
Wow, I didn't know that either. So if you're wearing it under your nose and then you have the blue one on, the protection is really not there.
It's not there. If you have it under your nose, you may as well just take it off. There's no protection if you don't have your nose covered.
Okay. And those are N95s.
N95s. And then there's a equivalent, and it was manufactured in China. There's the KN95, which is equivalent to the U.S. version of the N95.
Right, China. Got it. Got it. So I know with you being a nurse, what do you do now as it relates to COVID-19?
Personally, I make sure that I have my mask on at all times. When I'm out, I keep hand sanitizer in my car. Sanitize, wash your hands frequently throughout the day. Keep your hands out of your face. Don't rub your nose, your eyes. After you blow your nose, wash your hands.
Right.
That's.
And what about for work? What do you do for work?
Okay, so I'm contracted. I'm working with the Detroit Health Department, and I monitor the homeless shelters throughout the city of Detroit. And we go out and we monitor for residents that have symptoms of COVID, and we take temperatures.
Wow, so you must be passionate about what you do, because I think I would try to run from that job. Being on the front line like that, especially going into shelters and homeless shelters and things like that.
Actually, 3 days before I got the email, and it was actually supposed to be a one-day project, and 3 days before I got the email for the project, I prayed for the homeless, because I just thought, I'm like, okay, I knew the pandemic was coming, and I'm like, okay, so what are they going to do? Right. They depend on a lot of handouts. They depend on, where they're going to go and wash their hands. So I'm so happy that the city allowed them to come into the shelters without the time restrictions, because at one time it was, you can only come in at night. Well, now they're able to stay in all day.
Oh, good.
And they provide the meals, and we hand out masks to the residents twice a week. We hand out hand sanitizer. We get donations. They get donations. And, it's...
That is great.
And the numbers have been pretty low from the beginning.
That's amazing.
So we have a headquarters where if we find someone that's symptomatic, or if they go out to the hospital and they're positive, we have a headquarters that's located on East Grand Boulevard, and we house them there, and they quarantine there for 14 days. And
that is great.
Yeah,
the mayor's doing a great job.
He's doing an excellent
really
job. Excellent. I am so happy. So I was really grateful that God blessed me with that opportunity to help that population.
That's wonderful. Now, I've seen people with masks, especially women, that have beads on it and things like that. And I read an article and it said that the virus can is attracted to those rough surfaces. Is that true?
From the research that I've done, yes, it is. The virus can stay on surfaces. So
Right.
it's imperative that you clean your mask properly and frequently.
Even the outside with all the pretty pearls and studs, it's important that,
You have to clean them.
wow. I'm sure we don't think about that one because,
And I that's why I didn't even the fabric mask. I know people can't get it's hard to find the N95. It is. You know, I scoured hours I went out looking for supplies, and I still do, just to make sure that I have a stockpile. But it's hard to get it. So people, they have the homemade
or the pretty
masks.
ones.
And yeah, and they are beautiful,
Yeah.
and if you make sure that they're layered. It's better than nothing.
Right.
But make sure that you're cleaning it properly.
So with the cloth ones, I have a couple of cloth ones, and I wash them. They have a place for the filter.
Yes.
And I pull the filter out and I wash them. But the ones that have the beads on them, is there something they can do to maybe clean the outside? Because again, they're so pretty. But after I read the article, I didn't buy one because it's like, if the virus can get on those beads, then
Well, you can wash it. They can wipe it with like the Lysol wipes.
Okay.
To clean it. I mean, the virus it'll get on the outside of a regular mask.
one as well.
Yes, and that's why you don't want to touch that part.
Okay.
Yeah, you don't want to touch the outside. That's why you use the straps.
Right.
Yeah, the virus.
So even when you're adjusting it, then you should be grabbing it from the inside and not from the
you-
outside.
On the
On
there,
this-
and always sanitize your hands after you have to touch it. Keep your hand sanitizer ready, because if you touch it, you need to sanitize your hands.
That's amazing. So
Yeah,
what else do you have
it's a
here?
lot, and I just have a pair of gloves to show how to properly put the gloves on, and we call it donning and doffing. It's putting them on and taking them off.
Okay,
I see
show
a
us.
lot of people use gloves when they're out. So you want to grab it by the rim and secure it.
Not by the outside, as I see people
What-
do.
When you take them off, that's when you want to make sure that you don't touch the outside. So when you remove your gloves,
If you can put your hands up. Just,
okay. So when you remove them, you want to take them, grab it, take that one glove off, and then for the second one, you ball that one up in your hand, and then you take your finger and you go under to, which is not the contaminated, the clean side, and you just pull it over and dispose in the trash can
Properly, yes.
properly. Please, properly. I see gloves all over the ground.
I
Oh,
see
it
'em
drives me
too.
crazy. And then sanitize your hands.
that's amazing. That is so amazing.
It's a process, and that's another thing that I am a stickler on with training is the proper infection control. That's huge. That's huge right now because you have to think that you're with a susceptible population, elderly, and we're able to go in and out of the facility. So you need to protect them as much as possible, and I'm a stickler with that. Proper use of your PPE and having the appropriate PPE. So I ensure, I know facilities have shortages, so I stockpile N95. So when I take my students to clinical, I make sure everyone has an N95.
Okay.
And I give them a new one every day. We have clinicals every day. I mean, twice a day, and they get a new N95. So
That is great. Now they're saying the numbers are going up, but it's not the elderly. So what is going on with that?
this is a virus. Everyone is susceptible to this virus.
Right.
Um,
So
it
young people
doesn't-
were thinking that I know.
Nope. Everyone can get the virus. Now it affects everyone differently. Some more severe than others. Some people have no symptoms. And as we've seen, some people lose their lives. So my thing is I'm not going to play Russian roulette with the
Exactly.
virus
Right,
at
with
all.
yourself or the family.
Oh my goodness, no, my family think I'm a little obsessive, and I am.
Tell them your regiment when you go home.
Oh my goodness. So you take off your shoes. I take off my shoes at the door. I'm straight to the basement. Undress. Everyone stay in your room because my clothes are going directly into the washer. And now I have the hazmat suit on, goggles all day. So we're spraying down my team. We go out and we have two teams, and I spray down with Lysol all day when we're in the field. When I come home, my clothes go straight into the washing machine, and I'm straight to the shower.
Okay. All right, I understand. Would you give your contact information again for us?
Yes, it is Mitchell Healthcare Training Center. Address is 23217 Mac Drive, St. Clair Shores, Michigan 48080. Phone number is 586-541-8787. That's 586-541-8787. And the website address is www.mitchellhealth1.com.
Great. So, what information would you like to share with people who are watching on just being cautious and being more careful? You know, some of us don't take it as serious as others. So, what do we do? What is it that we should be doing, especially now that the numbers are going up again?
Avoid crowds. I know everyone wants to get out. You know, we had cabin fever because I did. But avoid crowds. If you have to go out, just do what's necessary. But when you go out, make sure you have your mask. That's number one, the mask and hand washing, and wear it properly. You have to wear it properly. And you have to wash your hands. Have your hand sanitizer, and it needs to be at least 60% alcohol-based hand sanitizer.
And some of it smells terrible.
Oh my goodness. Yes.
Wow, it smells really, really bad.
We get some donations from some of the companies for the health department, and I'm just like, oh, that smells like barf.
Yeah.
So,
Yeah, it's kind of hard. So can you apply some sanitizer to your hand? I was told that most people just apply to the palm of their hands.
oh no, absolutely. All surfaces. So you take a small amount
You have some. Okay.
and you rub, and you just go around your hand, and you want to get in between your fingers also.
Okay.
So interlock your fingers,
Okay.
and rub, and I go around my cuticles just to make sure all surfaces are covered,
Right.
and you rub it in until it's dry. So not as wet, and not that you want to rub it until it's dry.
Absolutely.
And when you wash your hands, sing the ABC song, and you want to get all surfaces. Same thing, same method. Interlock fingers, go around your cuticle, and you can go under your nails, and you can just rub your nails on the palm of your hand to get the soap under your
Get the soap
nails.
under your nails.
And you rinse and dry.
Great. And also wearing the mask under your nose. Now, I read an article that said that you can get it through your eyes, your nose, as well as your mouth. Is that true?
From the studies that I read, yes, less likely to the eyes, but definitely the nose and the mouth. And it's the nose and the mouth is connected. So it's all, you take in air, you can take air into your lungs through your mouth and through your nose. So I also, when I'm in the field, I wipe my face with alcohol swabs throughout the day just to clean my face.
Oh, okay. I was at it. We took our young people bowling a couple weeks ago, and we went when it opened. So there were only 3 groups of people there. We were so far away. But as we were leaving, there were about 60 or 70 young people in line. They were not social distancing. They did not have on masks. And I was just like, these young people are going home to their families. So what would you tell a parent if you have a young person, what that child should do, what that young person should do when they come in the house?
Strip down and straight to the shower.
Right.
That's it. You don't want to bring the closing because you're contaminated. No, and just stay at home. It's not worth it. I get it.
Yeah.
But if they have to go out or they do go out, have them take their clothes off immediately and wash them and take a shower.
And don't play with it. I mean, we don't know. I know several people, close friends, who have passed away. So we don't know what this is, or we don't know enough about it.
It's too new, and I believe, and this was back in November. My daughter had every symptom. She was in the hospital for 3 weeks. She was pregnant. Baby was delivered prematurely, and he was fine respiratory wise until about 5-6 days later. And I believe wholeheartedly that it was COVID.
Wow.
I do, and he passed away. So I'm not taking any chances with it.
I understand. We're about to close, so can you give your contact information again for Mitchell Healthcare Training Center?
Yes.
LLC.
The address is 23217 Mac Drive, St. Clair Shores, Michigan 48080. Phone number is 586-541-8787. That's 586-541-8787. Website is www.mitchellhealth1.com. That's
Okay.
www.mitchellhealth1.com.
Okay. And when you say St. Clair Shores, sometimes people think that's out there. It's really at what, 9
It's
Mile?
a 9 Mile in Greater Mac. So
Right.
I'm right by the Roy O'Brien car dealership. There's a cheesecake factory there.
Yeah,
but
but
right-
it's not past 9 Mile.
No.
It's right there.
No, it's right there on the corner of 9 Mile and Greater Mac.
Great. And then closing, again, I like to give information for people to keep with them. What are your final words, real quick, of what we need to be doing to stay safe?
You need to stay at home if you can. If you must go out, wear your mask. I cannot stress that enough. Wear your mask and sanitize your hands. Sanitize your hands, wash your hands. Those are the key factors to keep us safe.
Great. Well, Ms. Mitchell, thank you so much for coming on the show and
Yeah.
sharing your information. I really appreciate it.
Thank you for having me.
And you've been watching Expose Under the Sun, brought to you by the Detroit Native Sun newspaper, where you can find them in all Krogers. We look forward to seeing you next week. Thank you.